Good evening. This is Dr. Fran Cook-Bolden, and I'm going to present to you tonight on behalf of Aerolase Webinar Series, Effectively Treating Skin of Color with Laser. It's about 8:02 now, and we have a good number of people on the line, so we'll just probably wait another minute, and then we'll go on and get started. So while we're waiting for them, I'll go on and tell you a little bit about myself and about the presentation tonight. I am a dermatologist who practices in New York City. We have a very diverse clinical practice, so we do primarily general dermatology and derm surgery, but we have a large portion of our practice that is cosmetic and involves the traditional fillers, Botox, neurotoxins, but also laser surgery. We also have a full clinical research division and have worked very closely with Aerolase and many other device companies in the development of their protocols and also increasing the safety of laser procedures in skin of color. So tonight our presentation is going to be about half an hour to 45 minutes. We're going to see a short video, which I think might be very helpful just so that you can get an idea of the actual technique of using the laser. And then we will have time for question and answer at the end. So we should be able to wrap up no later than 9 o'clock, maybe before. So first of all, many people may wonder, why do we need a special presentation on effectively treating skin of color with laser? Well, in the past, lasers have been used for many, many years in dermatology and actually in many other fields, and patients of color have been one of the fastest growing segments that we've successfully used lasers. However, the pigment in skin of color has presented some challenges in the use of lasers. Initially, when lasers were started to be used in skin of color, you may have seen many news outlets about challenges, difficulties, burns, and it took quite a while to develop protocols, and fortunately, I was part of that, many years ago, over 10 years ago, in terms of developing those protocols for many devices. I have almost solely changed my laser modalities in my practice to using Aerolase because the ideal laser is one that can treat many disease states and many cosmetic issues in one modality. And over the years, I have found and seen tremendous strides in lasers overall for skin of color. And Aerolase has really, the Neo laser has been my go-to laser. So skin of color is definitely one of the fastest growing populations, not only in the United States, but worldwide. Tremendous strides have been made overall in cosmetics, and especially in laser treatment of skin of color. Things like neurotoxins, the Botox, Bellaterra, Dysport, there aren't really many specific changes that you have to make in skin of color, but laser modalities are very different. They can still be associated with some extreme discomfort and the potential for long-term pigmentary changes and scarring if not used properly and in the right hands. So I want you to leave tonight with a level of comfort in using the Aerolase laser with some comfort in skin of color. It's very, very user-friendly. I'm going to talk a little bit first about some of the reasons that we need to talk about laser and skin of color. And one of them is the unique properties of skin of color, which encompass the different genetics, some unique properties of the integument, such as the melanosomes and the fibroblasts, and the healing properties, the pigmentary reactions, and physiologic alterations. And what that refers to is the different responses that we see to external forces in skin of color. When we talk about skin of color, you can see here a number of different ethnicities, African, Asian, Latino, Pacific Islander. These are really just a few, but I thought we list these to show you that there's a very wide range, and again, this is only a very small partial list. I like to make note of the Fitzpatrick classification skin types because this gives us an idea of what we have already noted over the years and utilized very effectively in terms of identifying the different physiologic reactions, and in this case, that different skin types have to sun. To other traumatic forces, which you can consider laser an external, possibly traumatic force, skin of color has a different response to healing, so they're at greater risk of keloid and scar formation because of the exaggerated response of the skin fibroblast. And also pigmentary changes, whether it be hyperpigmentation, excessive pigmentation, or hypopigmentation, the response in skin of color can be very varied. So there's a much higher potential for pigmentary changes. Now, in this slide, you see it making note of the fact that there's more epidermal melanin, and that is true, and there's an increase in the number and size of the melanosomes within the melanocytes, and that is true. But as I'm sure you've seen in your clinical practice, this can sometimes result in hyperpigmentation, but also hypopigmentation, and neither one, of course, is a desired outcome. I like to review this slide briefly because it goes over three ethnic types, and many people think that there are a different number of melanocytes in the skin and a melanocyte to keratinocyte ratio, but what we see here is focusing on the melanosomes. So I want to take a minute and not focus on the melanocytes, but the melanosomes, and you see that they're very different in darker skin, which is the middle column, as compared to the Caucasian skin and Asian skin. So here you see very clearly the number of melanocytes in black skin and white skin are the same. The melanocyte to keratinocyte ratio is actually the same. Again, focusing on the melanosomes, we see that it's very different. In black skin, they're individually situated. In white skin, they're clustered. They are membrane bound in white skin, whereas there is no membrane in black skin. Black skin has a greater amount of melanin, which is primarily eumelanin, and in white skin there's much less melanin, and this is primarily pheomelanin. And as we might expect, there is just an increased response in black skin and in skin of color in general to physiologic stimulation, environmental stimulation, as well as pathological stimulation, with increased tyrosinase activity and an increased concentration of DOPA. So the 1064, or the YAG laser, which the Neo laser falls under that umbrella, but as you can understand, there is a broad number of 1064 or YAG lasers, has been the gold standard for treating ethnic skin. However, it is often referred to as the colorblind laser. So it's great and very safe for treating all skin types and specifically for skin of color. The 1064 nanometer laser technologies with ultra-long pulse durations, so this is your traditional 1064 laser, generally requires anesthetics as well as skin cooling in order for the patients to tolerate the treatment. These treatments can be very painful. If you've used one in the past, you have experienced this and your patients have experienced it, and it's very uncomfortable for patients. And in terms of cooling, which makes it a safer modality, that can be very costly, whether you use gels or cooling machines, and can be very messy. The development of a new 1064 nanometer laser technology with a unique 0.65 millisecond pulse duration, which is the LightPod Neo laser, enables virtually pain-free treatment in skin of color. There is no need for skin cooling or anesthetics and no skin contact during the treatment by the handpiece, which allows the handpiece to remain sterile. This uniquely gentle and sanitary laser treatment experience for patients of color increases the likelihood that your patients will notice a difference, especially if they've been elsewhere and had other laser treatments, and will return for follow-up sessions and get the recommended treatments. I think we have a little bit of a sound issue. Is this better? I'll try to get a little closer to the speaker. So this slide just talks a little bit more about that added safety margin that we get with the unique 650 micropulse width technology, and this does not sacrifice power. In fact, it makes the technology even more powerful, and it certainly does not sacrifice efficacy. So this graph may look a little bit complicated, but there are two ways to deliver the same energy. So we're going to compare the Aerolase, which is a very high power energy and a shorter pulse duration, versus the traditional 1064 laser, which is lower power that's spread over a much longer pulse width. So the traditional 1064 lasers often utilize pulse durations of 5 to 30 milliseconds, which are well in excess of the normal thermal relaxation time of skin tissue. Now, if you look at the blue boxes, can anybody see my pointer? Okay. So I'll just tell you that the thermal relaxation time for the normal thermal relaxation time for skin tissue, if you can use the bottom pulse width, is about 800 microseconds or 0.8 milliseconds. So if you can try to, guess if that's you see the 0, 1,000, and 10,000, the normal thermal relaxation time is about 800. With ultra-long pulse durations, the skin must be cooled continuously with gel sprays or with contact cooling plates. Additionally, in spite of the cooling, the treatment with traditional lasers can be very painful because the release of energy not only goes beyond the normal thermal relaxation time, which is 800, but it goes out to 5,000 and all the way out to 30,000. So when you give a pulse, you surpass the 800 thermal relaxation time of tissue, and it goes out to 5,000 to 30,000, which means that you have a very long pulse and you get much and a lot of collateral damage, and that's what we want to avoid. We want to avoid collateral damage. If you look at the Neo laser, and that's the first light blue box, the 650 microsecond pulse is isolated within that blue box, so it's only 650 microseconds. It's shorter than 800 microseconds, which is the normal thermal relaxation time. So it's a very quick pulse. It's a very powerful pulse, and this explains why the power profile is gentler on skin of color without sacrificing efficacy. So the bottom line, the main takeaway is that because of the very shorter pulse duration, it treats the skin beneath the thermal relaxation time, which negates the need for numbing and cooling the skin, and it enables a uniquely gentle treatment for skin of color without sacrificing efficacy. So let's go to the next slide. So again, it heats the targeted tissue much quicker, and our target in hair removal is the follicle. There is less time to lose heat to the surrounding skin, so there's more efficient destruction of the target, and you get less collateral damage, so you don't get destruction of parts of the skin that you don't want to affect. It avoids overheating of the epidermal melanin, which means that the patient is going to feel less pain and there's less of a pigmentary risk. And of course, we talked about the fact that it eliminates the needs for cooling areas. So this is a safe, easy, and effective laser. When we treat the patient, we start out by outlining the target area with a white pencil, as you can see in the diagram here. You don't have to touch the skin at all, so it's very, very sanitary. This, it employs a collimated beam so that the distance from the handpiece to the skin tissue does not affect the fluence or spot. That's one of the questions that's asked normally. Does it matter how far I am from the skin? And the answer to that is no, because the beam is collimated. The laser pulses are applied across the skin in a painting technique, very close together, with the handpiece held perpendicular to the treatment site, and there is no need to overlap the pulses. When performing hair removal laser, you can look for the visible sign of charring of the hairs, which is observed, and most hairs are vaporized upon impact with the laser beam. The treatment is performed in the complete absence, again, of any cooling and topical anesthetics, which is much different. Now, post-treatment, we do apply cooling just in the form of ice packs to the site, which is not absolutely required, but it just gives the patient an added layer of comfort. So this just shows some other light-based modalities that have documented history of causing pain and pigmentary problems. The IPL, the Alexandrite, which is a 755 nanometer laser, the diode, which is 810 and 950, and these lasers have been used on medium and darker skin tones. However, they have a much lower pulse width than the 1064s. And so in general, when you're treating darker skin tones, you really want to stay with a longer pulse width. You really want to stay with the 1064. That's going to give you your most colorblind treatment. What can we use the LightPod Neo for in Skin of Color? These are just a few of the uses. We're doing more investigations every day to expand this, but it can be used for hair removal, which is probably the number one, pseudofolliculitis barbae, acne, scars, and skin rejuvenation, and the treatment of active acne. And we'll look at some cases in just a few minutes. Nail fungus has been treated, spider veins, melasma, and other pigmentary disorders like post-inflammatory hyperpigmentation, and it has also been used to treat lesions of the skin such as dermatosis papulosis nigra, which is very, very common in Skin of Color. So this is a patient who was treated by Dr. Friedman, permanent hair reduction. So the first picture is the before, and the second one is 11 and a half months after the third treatment. The settings were a fluence of 18 joules per centimeter square, which is your setting of 5 on the laser, using your 0.6 millisecond tip. The spot size was 6 millimeter, and only one pass was needed. And this is a type 5 patient, type 5 skin patient. This next patient is treatment of pseudofolliculitis barbae. And, I would love to include in this treatment of post-inflammatory hyperpigmentation because as you see, as you compare the before and afters, there's a significant reduction in the hair as well as a significant clearance of the post-inflammatory hyperpigmentation. So this patient was treated with a fluence of 21 joules per centimeter square, which is equivalent to a mode of 6. Again, using the 0.6 millisecond tip, a spot size of 6 millimeter, and only one pass. So this person is a skin type 5, and there were 3 treatments. The post is after the 3rd treatment. This next patient, again, is a patient who was treated both for hair removal and pseudofolliculitis barbae, utilizing the same settings. Again, your after picture is showing the post after the 3rd treatment. Slightly darker skin type. This is a picture for PFB again from Dr. Gold and his nurse, Christine Murdoch, utilizing 21 joules per millisecond, again, mode 6. So that seems to be a very effective mode on types 5 and 6 skin, on the darker skin types, and very safely you see a significant reduction. And these papules are more inflammatory, more scarred over, but you see a significant reduction, and this was only after 1 treatment. So now we turn to active acne treatment. Active acne treatment is slightly different. In the active acne treatment, we start out with 2 pulses using a fluence of 21, which is a mode of 6, using the 6 millimeter spot size. And then they went back over the acne lesions using 159 joules per centimeter square, only to the actual lesions. So again, in this patient, you treat the entire skin with the 21 joules per centimeter square, which is a mode of 6, 2 passes, and then 1 pass over the active acne lesions. And you can see it's a little blurred, but significant reduction in the erythema is obvious. You do get a resurfacing effect also from the laser. This is a type 6 skin patient in the treatment of acne, active acne, using a fluence of 18 joules per centimeter square, which is mode 5, 2 passes over the entire face in the mode of 5, and then the 3rd pass is only to the active lesions, 2 millimeter spot size at 159 joules per centimeter square. This is a patient that we actually treated in my office. This patient came in very frustrated with his acne and his acne scars, had been treated for many years with topicals for acne, Accutane, a number of different laser modalities, chemical peels, and really felt like he had gotten no response. We told him about the Neo laser. I try to under-promise to patients when we tell them about the laser treatments, because they're very happy when they see much more than they expected. And in this patient, we actually combined his treatments with Microdermabrasion, which is something that I commonly do when I'm treating acne scarring or for resurfacing, for the resurfacing effect. I will do 1 or 2 passes with the Microdermabrasion, and immediately after the Microdermabrasion, I treat with the Neo laser. This was a mode of 6. We did 3 passes, and he actually was treated every 2 weeks for 14 weeks. And here is his after picture after 10 treatments. And he was very, very happy. You can see there was significant collagen stimulation and collagen reduction in the right places. So on the left side of his face, the surface was very uneven with some indentations and also some elevated areas, and we were able to even that out quite nicely. The right side did not have as much unevenness as the left, but it also responded very nicely. So giving the patients the proper expectations is important, and we told him it would take many treatments, and because of what he had been through in the past, he was very, very happy with this outcome. This is another patient with acne scars. It's a little bit blurred. I apologize for that. But you can see the depth, get an idea of the depth of the scars in the first picture, the before picture. Also treated with effluence of 21 joules per centimeter square, which is a mode of 6, after three passes with each treatment. And after the third treatment, you can see in the after picture, there was a significant improvement. Now, this is a patient that I treated once again in my practice for acne and post-inflammatory hyperpigmentation. Her active acne was relatively under control, but she still was not happy because of the post-inflammatory hyperpigmentation that is very common in skin of color, which can actually last much longer than the actual acne. Before she came to me, she had been treated with many topical medications to include retinoids, many bleaching agents, and anti-inflammatory injections for her active acne lesions. We treated her also with the mode of 6, 2 passes, and after only 2 treatments, you see there was actually significant reduction in her pigmented lesions, and her acne remained stable. And she was also a very happy patient. When treating post-inflammatory hyperpigmentation and other pigmentary disorders, you can also combine the laser treatment with other modalities such as chemical peels and microdermabrasion, again, as you can with the scars. Here is a case of hyperpigmentation, again, with pseudofolliculitis barbae. Mode of 6, which, as you see, is a very effective mode for treating many disease processes in skin of color. Only 1 pass in each treatment in this patient, and after the third treatment, again, we see the pigmentation. So this slide is highlighting the pigmentation effect, the reduction in the pigmentation. So now we're going to look at a brief video of me treating a patient in the Skin of Color seminar series that was held here in New York City. And can we start the video?
I'm going to demonstrate the light pod neolaser by Aerolase. The unique feature of this technology, you've heard a lot about hair removal lasers. Dr. Battle talked about the pulse durations earlier, and the traditional ND 1064 laser operates in a pulse duration between 3 and 30 milliseconds. As he mentioned, this pulse duration is significantly reduced. It operates at 0.65 milliseconds, which is significantly less than traditional lasers. That allows the skin to cool off significantly in between pulses. Therefore, you have less collateral damage, and you have more time for the heat to dissipate, if you will. By having less collateral damage, you can focus that impact and that power right on the target. You have less disruption, or if you will, thermal stress on the pigment cells and also on the nerve endings. So I have a patient here who has unwanted hair on her chin and underneath the chin. We're also going to treat her underarm, so if we can just take a quick look at her underarm. So again, before the treatment, we've had her prep by removing the underarm hair and the chin on the hair and the face and cleaning the area. Let's take a look at the laser for a second. We've talked a lot about hand pieces and utilizing different hand pieces. With the LightPod Neo laser, you only need 1 hand piece. The modality that you will change, depending upon what procedure you're doing, is the lens, which screws off very easily, on and off very easily. Now, with hair removal, you will only need to use 1 lens, so there's no need to change the lens. I call this my workhorse. When we're choosing a laser for practices, we want to find something that can do as much work for us as possible. We're going to focus on hair removal, but this laser technology can also treat inflammatory lesions such as acne, pseudofolliculitis barbae. It's also being developed modalities to treat onychomycosis, and there are published studies on that. And it also does non-ablative laser resurfacing very safely on all skin types, including very dark skin types. Today we're going to focus on hair removal laser.
Fran,
Yes, ma'am.
one thing I'm amazed at is the size of that
Cheryl,
device.
I love it. I'll tell a little story quickly. When I was starting my practice, I traveled between 3 offices, and I carried a very heavy laser between those offices. This laser packs up in this case. It's very light, very portable. Even if you just have one laser, you can easily roll it from room to room, and it's very easy to use. So it really has been my workhorse. I do have other lasers in my practice, but this has been my workhorse, and patients are very pleased with the results. We're going to start with this young lady, and you know, we haven't talked a lot about testing to the laser first, and at one point I preached a lot about testing before treating. With this laser, I found that I really did not have to do that because of these increased safety parameters. However, just to make sure that I have the ideal setting for the patient, I still do test the area. So instead of starting at the lower area or a middle area, I start at the area that their skin can really tolerate maximally. So I've already tested, Cheryl, and if we can just look at the laser for a second, there's not a lot of programming or anything that you need to learn. After you determine the setting by the test, I'm going to turn her up to a setting that's equivalent to 28 joules per centimeter squared. And we're going to start off by treating her chin and underneath her chin with the laser. The handpiece is also independent of distance, so we'll start with her chin. And you see it moves very fast on the area. There is no need to overlap pulses. And remember, because there's no thermal stress on the nerve endings, there is no pain that she's feeling. Turn to me. So we'll treat the other side of her chin. Again, there's no need to overlap, and there's no need for cooling.
And no gel?
And no need for gels. So I'm going to have her raise her underarm. So Cheryl, I've almost treated 2/3 of her underarm already.
How many sessions do you generally have to do with this device?
It's pretty equivalent to the other laser treatments. It really depends on, you know, just as with all the other laser modalities, how thick the hair is, how dark the hair is. You know, anywhere from 4 to 6 treatments. Some people only need 2 or 3, depending what settings we use. So we have completed this axilla. So with this laser, if we can look at the laser once again, the settings device is very simple. The handpiece is very simple and easy to use. As you see, the laser is very compact. It allows us with the micropulse technology to deliver the pulse very fast and focus on that target. Therefore, you don't need to worry about collateral damage, pigmentation, cooling, pain with this particular laser. And patients are very happy with the results.
Okay, so that ends our video presentation, and we will take questions and answers now. I will just tell you that in treating patients, what we do is we have them to clean the area, make sure the area is very clean, and that's very important, especially, well, for everyone, but if you have a woman who comes in with makeup on, you want to make sure that you have her wash the makeup off very well, and that you also use some sort of removal to make sure that all of the makeup debris is removed from the skin. If it is a larger area, you may want to grit the area with a white makeup pen, and then you can go on and move ahead with the treatment. You want to confirm for female patients and for all patients that they are not taking photosensitizing medications, and for females that they are not pregnant. The patients for hair removal laser are advised to shave the sites approximately 2 to 3 days prior to the treatment, because you want, ideally, and it really varies with the individual and how fast their hair grows, but ideally you want a little tiny stubble of hair so you can actually observe that visible charring. If there is no hair, you don't want too much hair though, so if you had to have a choice between too much hair and a slightly visible hair, for instance, if the patient forgets to shave 2 to 3 days before, or they just refuse to shave because of the problems they have, then I'd rather have no hair on the area. And what you would look for at that point is perifollicular erythema and edema. So some redness in the area and swelling of the perifollicular orifices, and that lets you know that the treatment has been effective. You do not want to see char. So we'll get started with some questions. One question is, should the patients be completely shaved before the start of the treatment? I think we did cover that. We want them to ideally shave about 2 to 3 days before and have a little tiny stubble so we can see the visible char. It just helps you in terms of in terms of making sure, something that you can use as a guide, that you've treated that area and it has been treated effectively. Let's see. Endpoints such as perifollicular edema and erythema, as well as singeing of the hair. So I was told that hair singeing is the only clinical endpoint that you need. So that is correct. If you do have a stubble of hair there, singeing of the hair is the only clinical endpoint that you do need. I like to see perifollicular edema and erythema, and many patients do forget to shave before, so we have to have them shave on site. And in that case, it's not time, that we don't have time for that perfect stubble of hair to grow back. And so I just look for perifollicular edema and erythema. Can you treat patients if they have waxed? You can, but I like for them to have waxed no closer than 5 to 7 days before the hair removal laser treatment, because as you can imagine, as you know, waxing is very traumatic as well. So I like for the skin to calm down some before we actually do the hair removal laser. The other difficulty with waxing is that waxing totally removes the hair, and it doesn't allow us that very small little stubble of hair to use as an endpoint and see the singeing. Let me just go to some initial questions. Someone asked a question about the use of the video on the website for their customers. I'm going to ask you to speak to the Neo Laser representative about that, and they can help you with that. Do any other lasers on the market have 650 microsecond pulse? Not that I am aware of. This was definitely the first laser to have that. I am not aware of any other lasers. Your representative may be able to help you more specifically with that question as well. Let's see, other questions. Do you have to push a button to pulse, or is it pulsing continually? Great question. It can do both. You use a foot pedal to pulse, and you can also, you have to use a setting actually on the laser to tell how much time you want in between each pulses. So you can use the foot pedal alone and pulse at your own pace, and I recommend that until you become very familiar with the laser. Once you become familiar with the laser, you can set the laser at different levels of pulsing, and all you do is put your foot on the pedal and keep it pushed down, and it will pulse at that setting. What do you do when clients come in with visible hair? Can you treat, or do you need to ask them to shave first? As I mentioned, we do have them shave first. If you have too much hair on the surface, then the laser target is distracted. It's not only targeted towards the follicle, but it also will target the hair on the skin, which we don't want. All lasers work by treating a chromophore, which is a color, and in this case, the chromophore is melanin. And because of the long pulse width and the deep penetration of the laser, it is able to effectively treat directly to the follicle without affecting the melanin in the surrounding area and causing that collateral damage. And so you do want them to shave first so that it's not scattered and you're not capturing the melanin in the hair on the surface. How much time do you give between laser and microdermabrasion for active acne? We do them on the same day. So we have the patient come in and prep, wash their face, make sure everything is off the face. We treat with the microdermabrasion. If you have a microdermabrasion that produces actual crystals, then you need to, again, make sure those crystals are totally removed from the face. So you want to wipe those clean from the face, and then you do the laser immediately after drying the face. Or if you have a crystal tip microdermabrasion machine where there are no crystals, then you can do the laser immediately after you complete the microdermabrasion. Did you have an extractor fan in the room? You do not need a fan, an extractor fan, when you're using the LightPod Neo laser. Other questions? Why can't you treat pregnant women? Simply, medical legally, we're very conservative with treating pregnant women, especially in the first trimester. And, pregnancy hormones, say, for instance, with hair removal laser with acne, you're fighting against the benefit of the laser. So I personally choose not to treat pregnant women. And there have been no studies and no recommendations in terms of treating pregnant women. So we just advise not to treat pregnant women. What treatment intervals are you doing for hair removal as well as for acne and acne scarring treatments? For hair removal, I like to do intervals of about 3 to 4 weeks. And the correct answer for that, which is true for any laser modality that you use, is as soon as the hair starts to grow back and you can visibly see it growing back, you can actually treat again. Just to make it a little easier for the patient in terms of scheduling and planning, I tell the patients to try to get the next treatment within 3 to 4 weeks. After doing the laser and this laser and other lasers for many, many years, I feel that if you wait more than 4 weeks, if you're waiting 6 weeks in between treatments, that gives the hair a chance to heal. That gives the body a chance to do what it normally does, and that's repair against any trauma and heat. And so it gives that follicle a chance to heal. And so you're almost starting over every time, or you're losing some of the benefit of what you've achieved in the initial laser treatment. So I try to do the treatments about every 3 to 4 weeks. I found those intervals to be the most ideal. For acne, for active acne, I generally treat every 2 to 4 weeks. And I think that is the general recommendation is about 2 to 4 times per month. So some doctors treat once a week. In Skin of Color, I don't treat that often because I think the skin needs to heal to recover from that heat in between, so I treat about twice per month. For skin rejuvenation, about every 4 to 6 weeks. For pseudofolliculitis barbae, again, about every 3 to 4 weeks, and 3 to 4 treatments is generally all that's needed. How about facial telangiectasias in dark skin with the laser? So I have successfully treated facial telangiectasias in darker skin with the laser. You want to make sure that you have a lot of experience in treating facial telangiectasias in skin types 1 through 3 first, and that you feel very comfortable with that. It's a little bit more difficult because you don't see it as clearly as you do in Skin of Color. And again, you're not only working with the erythema from the telangiectasia, but you're also working with the pigment in the skin. So I generally spread the treatments out a little further and use much lower treatments with telangiectasias in darker skin than I do with skin types 1 through 3, although you do use the other tips. The 6 millimeter tip, I do go to the 2 millimeter tip as well. Will the hair grow back again after removal? Did anyone capture the Q&A so that it can be sent to everyone? I think they are capturing the Q&A. So you can contact your representative, the person that you're in touch with from Aerolase, and they can get the information for you. Will the hair grow back again after removal? Once the hair follicle is dead, it's dead. It will not grow back. But again, the body is programmed to repair, so that's why it's very important that the intervals between the treatments not be excessively extended. Ideally, if you could predict how quickly the hair would grow back as soon as you start to see the hair growing back, that's a perfect time to treat again. You're pretty safe at the every 3 to 4 week intervals. How do you determine how many passes to use? Very good question. Experience, and it really depends on the individual. I think it's safe to start out with 1 pass. For most hair removal laser treatments, patients only need 1 pass. For the acne treatments, as I mentioned, you generally do 2 passes of a lower energy all over the face with a 3rd pass of a slightly higher energy right on the lesion. And you can do the same thing with pseudofolliculitis barbae. With post-inflammatory hyperpigmentation, I generally start out with about 2 passes, but 2 to 3 is a range. And so I start out with 2 passes and then see how they respond. So you're going to start out when you're thinking about passes on the lower end and, be guided by your patient's response. Do the patients need sunscreens after laser treatment? Absolutely. I tell patients of color and all patients to use sunscreen. So my recommendations for patients of color are no different than for any skin type. And because the skin is certainly more sensitive and more vulnerable after laser treatments, and it's a healing skin, you absolutely need to use sunscreens, at least an SPF of 30 or higher. How many days should a patient be off any retinoids or hydroquinone before laser treatment on the face? So a very good question. Many years ago, there was some thought that patients needed to be pre-treated with hydroquinone before laser treatment on the face. Then there were studies that said they did not need to be pre-treated with hydroquinone. I traditionally do not treat anymore, although pre-treatment with hydroquinone does not hurt the patient. So if they are using hydroquinone, I like for them to stop it at least a couple days before the laser treatment. For retinoids or retinols, I like for them to stop about 5 to 7 days before the laser treatment. Now, if you talk to other physicians, you're going to get other time frames. In skin types 1 through 3, sometimes they don't have to be off the retinoids. It can be off for 2 to 3 days. But for darker skin tones, I generally like for them to be off about 5 to 7 days. Okay, other questions? Okay, one question, what do you mean by patient's response? How do you know a response that is acceptable to do more passes in the treatment? So what I mean by that is when I'm treating for the first time, I start on the lower end of passes, so about 2 passes. And what I mean by the response is, again, I'm looking for perifollicular erythema or edema or just singeing of the hair. And also, I won't do more than 2 passes on the first treatment. And I look, when they come back, I evaluate the response of their skin. So that's what I mean by the patient's response. Did they have any, adverse event after the initial laser? Did they have any problems? Did they notice a change in the hair growth? And many times they won't notice a change after the very first treatment, but those are some of the questions that I ask them to determine that patient's skin response to the laser treatment. I still might do another 2 passes, and maybe after on the third treatment, I might go up to 3 passes if they have tolerated it well, which is indicated by no adverse events, no charring, no blistering, of course, those things we don't want, no dyspigmentation, and if they have tolerated it and I have had no issues with pain whatsoever, and if they say they don't really see a difference in the hair growth, and you may not see a stark difference, but I ask them questions like, are you noticing that you're tweezing a little bit less, or that the hair is not growing as fast, or that you're not needing to shave as many times a week, or it is not bothering you, the hair is not bothering you as much, which is an indication that the hair is either growing slower, because some patients don't really realize or note that they've changed in their behavior. So you really have to ask questions to find out if they have seen a difference in their hair growth or the response of the skin to the laser. What about treating scars? Good results for hypertrophic or keloids. Are any of these lasers billable through insurance? So the LightPod Neo laser, yes, has also been used to treat keloids and scars. And psoriasis is another indication as well. And a lot of customers I've heard from Aerolase rave about the treatment for psoriasis. I have had some pretty good results along with topical therapy for the treatment of psoriasis and a greater clearance time in between flares of psoriasis utilizing the laser. And for keloids and scars, I have used it for keloids and scars. In general, I use the 6mm handpiece, and I've actually used it for even very old scars and have been quite happy with the response, and the patients have been quite happy with the response. What we see with keloids is that the keloid, it does help to soften the keloid, and this is very helpful for patients who can't tolerate intralesional triamcinolone or Kenalog injections. I do use it along with some scar creams. And for older scars, I had one patient a female with a scar. It was a skin-colored scar, slightly elevated but very noticeable on her forehead, and that scar was about 10 years old. And using the 6 millisecond handpiece, we were able to completely flatten out her scar and blend it in with the other skin, with her surrounding skin. And so she was very happy as well. So it can be used on hypertrophic scars and keloids. I do not think that it is billable. We did not bill for those procedures. They were fee-for-service procedures. Okay. Are there more questions? We have a few more minutes. Can it be used for eczema? I am not aware. I have not used it for eczema. I am not aware of using it for eczema. If we cover the eyebrows and use small metal goggles, can we laser on the eyelid? You know, that's a good question. I have not done that. I thought about it, and theoretically, I don't see why not, but I have not done that, and I'm not quite comfortable with doing that right now, but theoretically, you should be able to. I have not seen any information from Aerolase about using it in that way for treatment of eyebrows, but I have not done that. Okay, we can probably take 1 or 2 more questions. How often are you treating scars, and how many treatments on average? We treat scars pretty often, and for scars, it does take a lot more treatments than with, say, for instance, hair removal or, some of the other PFB. I tell patients to expect, at least the 6 treatments, which is what I tell them for hair removal as well. But for scars, I tell them it might be 6, it might be 12, and it might be 20. Obviously, it depends on the height of the scar, how hypertrophic the scar is, how long the scar has been there, whether there's a vascular component to the scar. If there's a vascular component to the scar, then you tend to be able to use slightly fewer treatments and get a better response quicker. I want to just interject here for psoriasis. Aerolase has suggested that you may be able to bill for psoriasis, and the CPT codes that have been used in the past are 96920 and 96922. I would just check with my Aerolase representative to see. I have not done that, but I would check with the representative to see if they're still able to use those codes. As you know, a lot has changed with billing and coding, so I would just double check. But yes, those are some of the codes that have been used. So I just want to take this time to thank you a lot for coming to the presentation, for participating. We had a big audience tonight, lots of questions, and I know I have not been able to answer all of them, but your representative will be very happy to do that. And I have, again, had great experience with the laser. The take home is that, it is a micropulse duration, which treats underneath the thermal relaxation time, so you get an understanding why that negates the need for numbing, for cooling, and makes it very safe and sanitary for patients to treat in skin of color. Thank you very much.